I'm going to be talking to Dr. Rand Goldman, who is a professor in the University of British Columbia's Faculty of Medicine's Department of Pediatrics. And he's provided a list of tips for parents to protect their children against getting infected by COVID-19. So welcome to the interview, Rand.
Great. Good to be here, Markham. Good to be here.
Well, look, I really appreciate you doing this because on my social media feeds and the conversations I have, parents are really concerned, particularly now that the Delta variant is infecting children. Children are back in schools. They're really worried. So you've got a list. Let's go down the tips one by one. So does the Delta variant put children at greater risk?
Well, we know the Delta variant is really transmissible, which means more children are going to get sick. And we are actually seeing in our communities more children that have COVID-19. Maybe that's why parents are more worried. The good news is that they're not as sick as the adults that we've seen with COVID-19. There are very, very few children that needed to end up in admission to the hospital or in the intensive care. So it's a good news, but it still means we need to protect them and make sure they're not getting sick.
Now, what about long-term effects of COVID-19 on kids? Because we hear about, long COVID in adults. Is there anything, does long COVID affect children?
Well, we do have reports from other countries, not so much from Canada, that there is about a 10% rate of long COVID results in children. That may mean both physical, but also mental health issues that are seen 4 weeks or longer after they got infected. So this is really concerning. And I want to explain that this is maybe another reason why we need as parents to protect children and make sure they don't get COVID, because there are some initial reports. We don't know exactly what it looks like, but we need to protect children, not only from COVID now, but also the long haul that could happen.
So the children under 12 can't be vaccinated yet, though we understand that maybe next month or the month after a vaccine will be approved, but we'll see what happens. So until then, what measures can parents take to protect their kids?
Well, I'm excited that vaccines are coming to the ages 5 to 11, and maybe in the beginning of next year, 6 months to 4 years of age. This is going to be great because that's going to bring us to what we call herd immunity and a large percentage of the population vaccinated. What parents can do in the interim is all the public health measures we hear about. They need to listen to their public health, washing hands, putting masks as much as possible, staying away from other people. That will help kids stay safer, and also the adults and maybe the grandparents in the house.
Now, I've been doing some interviews lately, Rand, with various scientists and doctors about airborne aerosol transmission of COVID-19. And they make the point that that's those tiny little particles that are almost like smoke that hang around in the air for hours and can still infect someone. And they suggest ventilation and air filtration. So, can parents get air purifiers, for instance? Will that help?
Well, I think opening a window is a much more cost-effective way to handle this. Ventilation is very important, and this can be done in different ways. First, I know a lot of schools have worked on their purification of air systems. I think at home, you can open a window, even if it's cold outside, a sliver of opening and getting air circulation is going to be great for children. People can put a humidifier in the room to circulate the air, but I don't want people to get into too much expenses when it comes to air. We have fresh air in Canada, maybe some of the best in the world, and they can do that. If you have a play date between kids, try and keep them either outside or in a balcony or in a room with some ventilation, and this will help and keep them safer.
Now, I've got young grandkids, preschool grandkids, and my granddaughter often goes over and plays with a neighbor. So what kind of tips would you have for my daughter when she sends her kids over for a play date?
Well, first, yes, first I'm happy she continues to interact with other kids. From a developmental perspective, this is critical. That's why we need schools to be open and children to play. I think parents and grandparents, in your case, can do a daily check and make sure that both them and the kids that they're going to play with are healthy. If someone is sick, just cancel the play date. It doesn't worth the risk. And this is true for COVID, but it's true for all other viruses. And we start seeing other respiratory viruses this year, which we didn't see last year. Some of them are para-influenza, RSV, and soon I'm worried that we'll see a twindemic with influenza itself, the flu. So doing a daily check, making sure your child or grandchild is healthy and well, this is the first check to say, sure, they can do a play date. We as parents have a critical role in this and making sure not to risk other kids or ours when we do play dates or meet other people.
Now, you mentioned the flu, and of course, flu season is fast upon us. So how can parents spot the difference between flu and COVID-19?
Well, it's not as easy always, because both our respiratory systems, they cause congestion, runny nose, fever. But we know that influenza, especially in children, is it's a much stronger illness. It will appear shortly after exposure, between a day and 3 days, and will also cause quite an illness. COVID, as we see now, is kind of prolonged initiation of the symptoms. It's a vague sensation of some fever, congestion, weakness, tiredness. Influenza, getting the flu, makes you quite sick. So children will feel really unwell, and it's important to monitor them and see and comfort them and support them with a lot of hydration when they're sick with flu.
I've talked to a number of adults and seen many stories on social media and in the media about how adults can become very, very sick with COVID-19, sicker, a friend of mine described having COVID as, imagine the worst flu you could ever have and then multiply by 10. So it hits adults hard. But are you saying that it doesn't hit children quite as hard and not as hard as the flu?
Yes, we do not know everything about COVID. It's an evolving pandemic, so we're learning. But in general, the patients that I see with COVID that are children are not as sick. And the vast majority can go home when they go to their doctor or to an emergency department. So it's good news, but yet some children will have complications of COVID. One of them is called MIS-C, or multi-inflammatory systemic response. This is a very dangerous condition. So we need to remember this. We shouldn't just say COVID is not an issue in children. It is for a very small minority. Very rarely, a few weeks after exposure and being sick with COVID, they may have this very severe syndrome. So we really have to be cautious. Most of the children don't need to be in the hospital. We rarely see them in pediatric intensive care units, yet it could get worse. So we have to be cautious.
Yeah, speaking of getting worse, this will be my last question, Ren. But we know that the virus has mutated a number of times. Of course, we have the Delta variant now, and we hear about other variants. Should parents be on the lookout, keep themselves updated for information about potentially emerging variants that might affect children?
Yes, we expect variants to appear. That's part of the natural reaction of a pandemic or of a virus. So parents have to stay up to date. The way to do that is to go to reputable websites. I don't suggest to people to stick to social media. This could be including some misinformation, and you never know exactly where you get this data. When I look at the magnitude of information on the internet, I think official websites like Health Canada or your provincial health officer would be the best place to find information, and from there to decide what to do and how to protect your children. And listening to those recommendations is always a good idea, and checking on a regular basis in those resources is really a smart move by parents.
Well, Rand, thank you very much. Really appreciate this. I know parents who watch this will appreciate it as well. Thank you.
Thank you, Markham. All the best. Stay well.